Hi, I'm Dr. Perry. We've all had an experience at the doctor's office that feels a little awkward and a little uncomfortable, even doctors. So I'm going to tell you about mine. It came after this bout of this sore throat that I had been having for weeks. I was getting super sick, I still had a fever, I had taken 2 courses of antibiotics and it was just not letting up. So I went to see my family practice doctor, who also happened to be a colleague. This was a nice, docile, kind of Mr. Rogers type man, and he's looking at me perplexed, trying to figure out why I'm still sick, and he starts asking questions, and then he just sits there with a red look on his face and no question. I'm like, where is this going? And he looks at me and he's like, "Are you sexually active?" And I said, "No." And then he's like, and that's when it hit me. I knew what he wanted to ask, but was too embarrassed to ask. And I said, "Not at all, not orally either." And I think where he was going with it, well, actually, rather I know, is he was worried if I had gonorrhea of the throat. Yes, this is a thing. This is a thing that happens that a lot of people do not know about. So today I'm going to talk about gonorrhea and also chlamydia, because a lot of these times these are 2 STIs that occur together, sexually transmitted infections. They're both bacterial and they often occur together, so we're going to kind of talk about them all in one. So gonorrhea and chlamydia, like I said, are sexually transmitted, and a lot of times there can be no symptoms, but other times there are symptoms. If you are going to get symptoms, it's going to happen between 2 and 21 days of sexual contact. The symptoms that you're going to want to look out for are going to be either a discharge that comes vaginally or from someone's penis, redness, burning of the vulva, which is the area of your vagina kind of on the outside, burning and stinging with urination. You can also get abdominal cramps. Some people get a fever. If it's in your throat, as my doctor thought maybe was happening with me, you can get a persistent sore throat. Or you can also get swollen lymph nodes, either here if it's in your throat or down here in your pelvis if it's a pelvic infection. Now, gonorrhea and chlamydia, if left untreated, can actually lead to something that's called pelvic inflammatory disease, or PID. This is a much more aggressive disease, and it's an infection of your uterus and your fallopian tubes, and it can make you really sick, and if left untreated, it can also lead to infertility. So that's why it's super important to be getting checked regularly for STDs, because these are very common infections. So if you've had unprotected intercourse with any new partner, then you need to be checked for these infections. Or if you have any of these symptoms a few days or weeks after having intercourse with someone, again, go to your doctor and get checked, because again, these are treatable. You just have to know you have them. So there are some tips and my embarrassing story. If you have any comments or questions, please leave them in the comment section, or any other topics you'd like me to discuss, and I'll get to them. Thanks.